53, 7 minutes in front of 9 o'clock. Our next guest into the Daily Connerton Memorial Company Chair is a familiar name. It's a familiar voice as well. We know him as the president and founder, CEO of Columbia Dental. I know him as Dr. Mohammadi. Great to see you this morning, Doc.
Good to see you, Gary. How are you?
Doing well, doing well. I compliment your wife because every time I see her, she's always smiling. And of course, I realized right after I said that, of course she's smiling. She's married to a dentist. She has to smile. What's new in dentistry right now?
Well, there are a lot of things new in dentistry, but these days we are doing a procedure called All-on-4. And what exactly that procedure means is that, unfortunately, many people, they don't take care of their teeth during their lifetime. So they reach to the level that the teeth is not going to be savable. We cannot save them. The prognosis are going to be so poor that even with the root canal, cap, crown, we cannot save those teeth, or it become impractical to save the teeth. Like you have multiple teeth, they have multiple, need multiple invasive procedure, gum treatment, root canal, crown, you name it. So it's not going to be a practical option. So older days, what we did, we offered the patient dentures. We told them, okay, unfortunately, the teeth are not savable, so we can make you the denture. So the patient always was telling us, all right, doc, I cannot walk out without teeth.
Right,
so we offer them, we can make the denture ahead of the time. So we make the mold of the teeth, we remove the teeth on the mold, and those denture called immediate denture. Immediate denture means you remove the teeth and at the same time you insert the denture. Of course, that denture is going to need relining, refitting, and so on. So, however, these days, due to invention of the implant, there is another procedure that we can offer the patient to avoid wearing the removable denture. So this procedure called All-on-4. So the process is the same way. We take the mold of the teeth, we remove the teeth, we place the implant at the same time of the extraction, and the patient walk out of the office with the temporary fixed teeth.
Who else is doing it? No one's doing this.
Well, this is a very complex procedure, and at Columbia Dental, because we have different resources, need different specialists, prosthodontists,
all under one roof.
All the lab, digital lab, we have it all on one roof. So those components, they need to work in collaboration with each other. So that's why we can do that.
Let me ask you this. What is Columbia Dental? What do you perform the most? What's the most popular procedure, or it's requested more than anything else?
Again, depend on the location, but in our Manchester location, which we name it Columbia Implant Center, that procedure, that All-on-4 that I mentioned is bread and the butter of that specific location. In other location and our satellite location, we do different aspects of dentistry. We do have all different type of specialists, including pediatric dentists, periodontists. So we are a multi-specialty practice. We do all aspects of the dentistry. But again, in our on Manchester location, we do this procedure because we are capable of doing that in the same day, 7 days a week.
Technology is always evolving, and it just seems like every time I'm talking to you, Dr. Mohammadi, Columbia Dental is always on the cutting edge of it. There's other innovations, though, that are in the pipeline. What are you hearing?
Well, there are a lot of innovation. For example, these days, our periodontists, they are using very non-surgical approach to treating periodontal treatment, using laser, using antimicrobial agent. Everything, it become more precise and less invasive, we do procedure called guided surgery. So everything is become, due to the technology, more accurate, and as a result of the accuracy, there is going to be less invasion to the body, less as the result, less post-operative complication, pain, and so on. So
And you're always, and I've known you now years, you're always at the forefront. You are so way ahead of other dentist outfits out there. I only got about a minute left. I've got to talk to you about staffing shortages. How do you find qualified workers? You know, like 11 locations, right?
well, it is challenging, obviously, but luckily there is a program. It called H1 visa. We are sponsoring many foreign trained individual. They have very good background. They have MBA, MPH, or they are dentists back their home. We use them as a staff. So far, we are sponsoring 5 or 6 of them, and that experience been very great.
I know you have locations all throughout the state. Your main hub, though, being in Manchester. Right?
Correct.
All right.
Correct.
So if you'd like to make an appointment with Dr. Mohammadi or any of his well-qualified and experienced staff at any of the Columbia Dental locations throughout the state, jump online, columbiadental.com. Doc, great seeing you again. Let's not let it be so long this time, huh?
Good to see you.
It's
Thank
always
you.
my pleasure. All right, top